Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 9 deaths due to COVID-19. I want to extend my condolences to their friends and loved ones. The current 5-day COVID-19 test positivity rate is 11% provincially, 11.4% in Winnipeg. 474 new cases of virus have been identified, bringing our total number of cases to 9,782. These are, of course, sobering numbers. We're announcing more than 2,500 cases in 1 week and more than 20 deaths in 3 days. That's why we've introduced a number of provincial-wide restrictions through the pandemic response system to reduce the spread of COVID-19. Effective today, this includes social contacts must be reduced to your household only, and you must not have social gatherings. Gatherings of more than 5 people from outside a single household will be subject to fines. Travel to and from northern Manitoba is restricted under the public health orders, and non-essential travel is strongly discouraged. We have public health orders in place. Retail businesses listed as critical services, such as grocery stores and pharmacies, can remain open at 25% capacity. Retail businesses not on a list are able to provide e-service, curbside pickup, or delivery services only. Other critical services can operate as set out under the public health orders. Many businesses must close, including personal services businesses such as hair salons, barbers, and sites offering manicures, pedicures, and aesthetic services. Gyms and fitness centers, recreational activities including sports facilities, casinos, museums, galleries, libraries, movie theaters, and concert halls. Religious and cultural gatherings must close or be provided virtually only. Restaurants must close to the public and may be open for delivery, drive-through, or takeout only. It's unfortunate that there's been some confusion regarding these orders, because the message has and continues to be clear. The message is stay home. The message is do not socialize outside of your household. The public health orders themselves are simply just a tool. They cannot always be identical to public health's strong recommendations. Public health orders and regulations and other laws need to be black and white. It's hard to take in the myriad of possibilities that occur in day-to-day life. So our messaging is clear. The orders are clear related to who can be fined. But let's just be absolutely clear that the message from public health is to stay home, leave for essential reasons only socialize with those inside your household. We needed to find a balance because we know that these type of orders have different effects on different individuals. Some people live alone. Some people need support of a neighbor or a family member. Some people need child care support. We don't want them thinking that they will be under threat of a fine just to receive some help that they need. So the message is clear, to stay home, to only socialize within your household. I will remind everyone that there's been a lot of calls to go back to a lockdown, the term that's often used in letters to us, that we saw in spring. Well, in spring we had group sizes of 10, and in spring those didn't apply to private residencies. In spring, in our toughest restrictions prior to this, there was no restriction on private gatherings. There was nothing in those orders to prevent somebody from having hundreds of people at their house. But Manitobans listened to what public health advice was, and they'll listen again. These are the most restrictive orders we've had to date in Manitoba. And it's because we're at a very critical juncture. Our hospitals are nearing capacity, and so we need to ensure we're stepping up now to reduce our contacts. We don't need distractions now. Distractions are harmful to Manitobans. The message is clear: stay home, only socialize within your household. Since the orders were announced, we receive numerous requests for businesses to be added to the critical services, petitions along the same line. If we allowed all these, there wouldn't be a single thing required to close. So again, we are at a critical juncture right now in Manitoba. We need to make change, and we all know how difficult it is. If you're a business owner that's been affected, it's challenging. If you're an employee in one of those businesses, of course, this is difficult times. But our hospitals are nearing capacity. We have to make a change now. We can't find ways around these orders. We all need to step up now for Manitoba to ensure we interrupt the transmission of this virus. It's not going to be easy, but it is going to be short term. And we're going to get through this, but we can only get through this together. We can't get through it with distractions. We have clear messages: stay home, socialize only within your household. All of these messages, no matter how difficult they are to hear, they're there to save Manitobans' lives. And so I want to thank Manitobans for all their work on this and their continued work, because we're not done with this, obviously. But moving forward, if we follow these orders, don't try to find ways around them. Don't try to find ways that Manitobans can gather. Right now, we need to reduce our contacts dramatically. We'll start to see these numbers come down as we did before. So thank you again, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary question and two follow-up questions. Up first this afternoon from CJOB, Will.
Good afternoon, Doctor. I'm just wondering, based on contact tracing and other methods, are social gatherings still the main means of transmission? And if not, where else is the virus spreading right now?
Yeah, and so right now we're still seeing cases that were related, before we had a lot of restrictions on. So some of the problem is that a large proportion of that we can't epilink. We can't necessarily say where that was acquired from, so it's difficult to know. That's why we have widespread measures in place. But we just know how this virus is spread, right? Prolonged indoor contact. And so that's what all these restrictions are geared at, is to reduce those numbers of contacts. What we do know for sure is the number of contacts per case has dramatically increased over time, especially the range of that time where we're seeing people with 60 contacts. There's just no way we can manage a virus like this if cases are having contact with 60 different people.
Okay, thanks for that. And still going with the contact tracing, can you tell us where that's at right now, contact tracing and recovery tracing? How far behind are we? What capacity is the Red Cross helping right now?
Yeah, and so we do have the Canadian Red Cross and Statistics Canada right now providing support. We have public health nurses who are largely doing what's called the case investigation, finding out who the contacts are. Notifying those contacts are being done now largely by Canadian Red Cross, which is freeing up a lot of time for the more pressing work, the case investigation from nurses. So we don't have a significant backlog in that, and our capacity continues to increase as we have these Canadian Red Cross and Stats Canada on board.
Okay, thanks. Final question. Still getting some questions about personal care homes and visitors. Are they accepting visitors? In what capacity and why?
So we still have the caregivers, the family caregivers we still allow, again with appropriate screening. All those people need to reduce their contacts, right? By bringing any risk of bringing that virus in will be reduced if you reduce your contacts outside of there. And so we heard, early on in this where we had very dramatic visitor restrictions in the first wave, really to protect that very vulnerable group, which we see as quite a vulnerable group. But we also heard the negative implications of having such a dramatic restriction on it. So we're trying to find, again, that balance to be able to allow people still have the support of loved ones, while at the same time limiting the number of people that enter those care homes.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. First question, why did the public health orders change from Tuesday to Wednesday?
Public health orders didn't change at all, right? So the messaging has maintained the same. So this is the message, right? The message is clear. Stay home, socialize only with members of your household. The public health orders, again, it's when we have a black and white order, we have to be aware of people in circumstances where they rely on certain family or friends to provide care to them. And so it's very difficult to write orders that can address every possible eventuality. So the orders have never changed. The orders never had anything else written in them than the group size of 5. It's the messaging which is important. The messaging is clear, and that is stay home, socialize only with members of your household.
Fair enough, but why change? Why not put it in the order that people can't socialize outside of their household, but exempt, family members, healthcare workers, like things that would just be obvious exemptions?
Well, not so much, right? So what would we exempt? There's certain things, childcare, but is that grandparents coming, or you're only allowed one? Or can you have both grandparents come? Is it provide childcare to people working in critical services only? Or are we going to go actually to those homes and ask someone to provide proof that they work in a critical service, and that's why they have people watching their kids? So we all think about what's necessary to enforce, right? We have people with medical issues who get support from family and friends, and so which medical issues? And will they need a note then? So it's very difficult to write orders to every possible eventuality. What we're relying on is the messaging. And I really think that distraction from that messaging is what's harmful to Manitobans. The messaging is very clear, and we'll repeat it, is stay home, socialize only with members of your household. And that's the message, period.
And I understand that. The messaging has been clear. Well, it depends on who you ask. People say the messaging has been inconsistent. You've said for a long time that staying home and that sort of thing is what is needed. But given our numbers, that's obviously just not happening. So why not write it into an order to have it so that it is, essentially, I don't know if it's a law or whatever it would be, but have it so that people actually have to follow it instead of just having a strong guideline or whatever.
Well, there's lots of things like that, right? We have people leaving their homes for essential reasons. We say only one person go to the grocery store. That's certainly not in order. We've advised businesses to have their employees work from home when at all possible. That's not in order. And so it's just, like I said, it's very difficult to write orders to work on every possible eventuality. So the orders are written black and white. They're written with clarity. Those are what's we would enforce. But the messaging is quite clear. And like I said, in spring, where many people consider that a lockdown, we actually had nothing in place to limit the amount of people to go to a private residence. So these are by far the most restrictive orders we've had in place, and rightfully so. We're at a critical juncture right now. So the messaging should just be stay at home, socialize only with members of your household, and no distractions from that.
From CBC Radio Canada, Amelie.
Hi, Annalie from Radio Canada. Just to come back on that question, so that you're saying that it's really difficult to write those kind of health orders and to take in account different situations. But does that mean you're suggesting that this rule of would not have been possible to enforce? So does that mean that it is possible for you now to make sure that people will gather with only 5 people and not more? Do you have any tools to make sure that this happen? And if people, for example, are gathering with 6 people in their house, does that mean that they're going to be fined or anything like this? Do you have any tool to monitor that?
Well, that's the public health orders, again, have to be clear and unambiguous, and they are enforceable. And so we've vastly expanded our ability to enforce those. And yes, if there are gatherings greater than 5 people outside a household, those are subject to fines, and we are looking at ways to be able to do just that. Why we haven't just put in the order that you must stay home or you can only socialize with members of your household in an order, like we mentioned, there's a lot of exemptions to that. There's a lot of people who would be much more adversely affected by that than others. And so it's very difficult to write a black and white order for that. So the messaging is very clear: stay home, socialize only with members of your household. And unlike in spring, we have public health orders that are quite enforceable in those group sizes, even within private residencies.
Thank you. And do you, so basically what you're saying is that at some point the province cannot enforce its own regulation and can only stress people to follow that messaging you're talking about?
Certainly the group sizes are enforceable right now. And just like most of our messages are the public health strong messages to Manitobans, that our hospitals are at critical junctures right now. They're nearing capacity. We have to change the trajectory of this virus right now. And that means staying home, socializing only with members of your family or with your household.
Thank you. And one last question. The First Nations in Manitoba have been disproportionately hit by the COVID-19 now. What are you doing specifically to protect them during the second wave? What is the province doing?
Yeah, and so, right at the beginning, before the virus is even here, we know that, our Indigenous the people are at risk of disproportionate effects of this for a lot of reasons. And so there's a lot of work with our federal government colleagues at First Nations Inuit Health Branch. We have the pandemic response team working directly with multiple First Nation leaders. And we see how great the leadership stepped up in that first wave and continues to do now. And so really at the overall level is the best way to protect people who are disproportionately affected is to decrease transmission of the virus overall. And so these public health orders are in place to decrease the amount of transmission of the virus. That's going to decrease the amount of virus that's introduced into personal care homes. That's going to decrease the virus that's introduced into Indigenous populations as well.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. As I'm sure you're aware, BC had a household-only rule order, in place back in March. Is there a legal reason as opposed to a logistical reason? Is there a legal reason why a household-only rule could not exist in Manitoba?
Well, I won't speak on, whether there's a specific legal reason. I think that there could probably be an order written with that. The issue is what we've said what I've spoken about is the disproportionate effect that could have on certain people, the difficulty in legitimately enforcing such an order. And then the trying to write the myriad of exemptions that would have to be required for that. So order-wise, like we said, we don't have to rely on orders for every possible public health advice. And our advice here is very clear. It hasn't changed since Tuesday. It's to stay home and to socialize only within your household.
All right. Doctor, you said a couple of days ago that contact tracing is backed up, but we're still hearing from people who are waiting days, sometimes more than a week. When will there be, we're also hearing that the Red Cross resources have already been exhausted. When will there be more resources devoted to contact tracing?
Well, there is still a ramp up with Canadian Red Cross and Stats Canada, but we do have them right now dealing with the contact notification. And so we look as far as our public health nurses go. It varies on how many we would have access to just for contact tracing, but it is in the 120, 130 region. It can be higher than that on certain occasions. And we really have a goal of the public health nurses, on average doing about 4 contact investigations per day. That can increase now that the contact notification is going to Canada Red Cross. So you can see that on days like this with our capacity, we are reaching that ability to be able to handle these type of case numbers, although we don't want to on a sustained basis, right? We have these orders in place to try to bring these daily case counts down.
Thank you for that. And the other unrelated question is, did Public Health approve the move of Flin Flon's hockey team to Creighton, Saskatchewan, so that team could continue playing?
No, it doesn't require approval, right? And these are the kind of things that I speak about. And again, it's not to call out anybody, right? But it's these orders are in place to protect everyone and protect Manitobans. So I just really discourage Manitobans from trying to find ways around the orders. I know they're difficult. They're more difficult in certain people than others, and we all know that. But we just can't spend our time right now trying to find our way around the orders. Right now, we need everyone just to step up, do their part, and let's bring these numbers down together.
From the Canadian Press, Kelly.
Hello. So kind of going back to the public health order, is it within your power with public health orders to limit people to their households, or under the Act would that be considered unreasonable to infringement on their rights, and did that play any role in the decision?
Well, no, that didn't actually play a direct role in there. We had not deliberated adding that to the orders. The orders were the group size limits. The messaging when we went to Red was what we were working on, and we wanted to send that clear message. So now, the questions you asked, like, so the Public Health Act, there likely is provisions to write such an order. Whether it holds up to a challenge is not a question for me, but again, the message is clear. The message is clear to Manitobans to stay home, gather only with members of your household socially, right? Don't try to find ways around this, right? Just like we've heard of different organizations trying to find ways around the orders. Same thing. Don't try to find ways around this. Don't think that just because you can't get fined for having more than 5 people, that's what you should do, right? That puts people at risk. People who are at home and vulnerable and require some assistance from friends or neighbors or family, you don't need to be afraid that you're going to get fined. But other people, you should just socialize within your household. I know that's difficult, but it's short term, and it is definitely necessary if you look at our hospitals right now.
Polling says that people are more likely to follow rules than suggestions. So how can you rely on the fact that your messaging says stay home, but we have case numbers that show that people aren't doing that?
Well, these orders have just been in place for, about 12 hours. So, so I think that we can't judge what people are doing based on these orders. So, we had this scenario, and like we say in spring, where what people describe as that lockdown, we're more restrictive right now, and as it should be. But we had no limits on private gatherings in spring. In August, when we put Prairie Mountain Health into orange, we had no limits on private gatherings. The group sizes only applied to public gatherings. So this is really breaking ground for us, where we actually limit private gatherings. And so it's difficult, but it's definitely needed.
And I'm aware that Lynette usually speaks to this, but with these numbers today, especially considering hospitalizations in ICU, can you give us an update on healthcare capacity?
Not necessarily the capacity. I can give you the numbers. So we have 227 in hospital, 34 of which are in ICU.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin. I know you've been saying that the messaging has been quite clear on the household front, but I wonder what your thoughts are for more vulnerable populations. I'm thinking new immigrants, low-income individuals, those just coming out of the justice system who may not have permanent housing. So can you say this messaging is necessarily clear for these populations when they may not have a fixed household?
Yeah, and so certainly the group sizes are what matters, and we know that there are people who are more vulnerable or susceptible to this and are disproportionately affected. So none of our orders are there to try to be directed at people who are disproportionately affected. Right, so we have support structures in place. We have alternate isolation accommodations, but we know it's a very difficult area. But again, we don't write these orders to be able to now try to find people who are homeless, or in jeopardizing situations. Right, these messages are for all Manitobans to do their part, and moving forward, if we all step up, even in the short term, we can start seeing these numbers turn around.
Yeah, and my first follow-up question is just on the rising death rate in the province. Some stats show that deaths here are increasing at a higher rate than other hotspots in the first wave. There are projections saying that Manitoba could reach a death toll by 2,600 by February. So what is your concern about the rate of death we're seeing in the province right now?
Well, when we're looking at a pandemic response, our number one goal is to reduce morbidity and mortality. So it's always our number one priority. So we want to reduce morbidity and mortality. We want to reduce the strain on the healthcare system to ensure the healthcare system is there for all Manitobans. And so certainly we know we're going to see those disproportionate mortality rates when we have the virus in personal care homes. We know the devastation, and we've seen that in other jurisdictions. And so we have to do whatever we can to really protect that vulnerable population. But otherwise, the trajectory is what you mentioned. The trajectory is the reason why we've gone to the most restrictive measures we've had in place now. We don't have any time to waste. All Manitobans need to step up right now, stay home, socialize only with members of your household, essential tasks only, and practice those fundamentals at all times.
And then to come back to the Flin-Flon hockey games, I'm wondering just more on that front, just your thoughts on, is it wise for a Manitoba team to really be traveling outside of the province right now? And what control does the province have in this rather unique situation where a Manitoba team is playing out of a Saskatchewan league?
Yeah, and again, so it's I'm not here to call out anybody. It's the messages to all Manitobans about how important these orders are. And so the orders are in there for a reason, and ultimately that reason is to save Manitobans' lives. And so I would encourage all Manitobans to not look for ways around the orders. And I know it's tough. And I know this situation, probably seems innocuous, but it's not, right? So we've limited these type of gatherings, this type of recreation, because we've seen spread there. And so as far as what they don't violate the orders right now, so that's clear. But it's not necessary to violate the orders. What's necessary is for people to step up in Manitoba and realize that these orders are here to save Manitobans' lives. And so we don't need to find a way around them. We just need to find a way to step up and follow them.
From City News, Mark.
Good afternoon, Dr. Roussin. With respect to what you're saying about these orders only being in effect for 12 hours, we have seen over the last month the numbers trending in what you called the wrong direction. So I would ask, why not make household overlap enforceable? And if and when people do overlap and a ticket is issued, you allow them to appeal that to a governing body, or you sort that out after the fact, restricting people who aren't going to listen or who are going to try to interpret that rule because there isn't enforcement. Could something like that be done?
Well, we've never taken things off of the table, but again, the message is clear. So that's the big story here, is right. The message is clear: stay home, socialize only with household members. Right. I don't want to distract from that. All the talk about what the order could look like, it distracts. The message is very clear: our hospitals are nearing capacity. Right now, we need to change what we're doing. So we've shut down a lot of non-essential businesses, and that endears a lot of hardship for Manitobans. We've heard from them. But it's necessary. Now we need to do all our part. Stay home, leave only for essential reasons, and socialize only with members of your household. We don't have to get into the details of what orders could be. The message is just clear. I don't want to get distracted from that.
Apologies for interrupting you. Thank you. Last week we were hearing about a circuit breaker. Some people have sort of alluded to the code red we're moving into mirroring that. Obviously, it's not going as far as other regions. At what point, if numbers continue to get worse, might you look at a total shutdown? Some people say it will be sharper and harsher, but it won't last as long. Is that something that you're exploring or thinking about?
Well, we don't have anything off the table, right? We had this list of critical services right now, and things like that can be reviewed depending on what our numbers are. We think that as people step up here, we're going to start seeing this trend downward with these. But again, the circuit breaker approach is can be effective, and it's nice to think of these as really short-term solutions. But we're going to be dealing with this virus still for months and months and months, if not a year, or if not possibly more. And so we do have to find ways of sustainably dealing with this virus. But first and foremost, we have to get these numbers down. So nothing's off the table on what's required to do that. But right now, these are the most restrictive orders we've had in place, and we expect them to have an effect.
Thank you. Some of the care homes and other areas that have been assisted by the Red Cross, you've said, have seen a positive response relating to that. At what point might we look at bringing in the Army to assist us here in the province if we continue trending in the wrong direction?
Yeah, and so this is the one of the main purposes of these orders, right, is to bring down these numbers, and that's going to have the positive effect on on those vulnerable populations as well. And so you're right, we are receiving support. There's a lot of work in the regions to ensure that staffing and resources are appropriate for this. And, at some point, if we feel that we have to look at other options, then we've never taken anything off the table. But we don't have any timeline or definitely any specifics related to the military.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, you keep referring to as how we kept numbers low in the spring, low numbers of household gatherings. Do you think we can do this again?
Yes. Yes, yeah, we're going to, we'll get through this, but we have to get through it together, right? You can see that probably a vast majority of Manitobans have always stepped up, been on board through the entire pandemic. But you can see how this virus spreads. It doesn't take much to shift the trajectory. So we're going to get back to it. These are quite restrictive, so we have a lot of people out of work right now, but it's necessary. We're going to have a lot of people staying home, socializing only within their household. Again, not social isolation. Stay connected with loved ones. But we're going to step up again. We're going to see these numbers come down.
And you said this is difficult for people to hear these new restrictions and the recommendations to stay home. What can people do to make this change easier on them?
Well, it's going to be challenging, but I think what the message is that it's absolutely necessary, right? We've heard from frontline healthcare workers. We're hearing from public health. You can see the trajectory that these are necessary. So together we can step up. If we all do our part, we're going to see these numbers come down relatively quickly. We're not going to have these type of restrictions in, hopefully for long, but we just definitely have to change what we do right now. And I know that's difficult, and we know that because we're receiving much correspondence, about with petitions or requests to be listed as critical. And like I said, if we followed all of them, we wouldn't have anything closed right now. And we just know we have to, and we know that's difficult, but we really hope it's going to be short term, and then we're going to recover together as a province.
And there have been a lot of strong emotions coming from Manitobans for the past couple of days. What's it like being in your position to hear these things?
Yeah, I think that it's recognizable that these restrictions are quite challenging, and so I think that there are people, and rightfully so, voice their disappointment or the challenges that they're seeing. I think that there's a lot of wishful thinking that if we just ignore the virus, that this is just the flu, that will be okay, and I can understand why people start thinking that way after 9 months of this. But you can see from our numbers, you can see from the deaths that we're reporting here, the effect that this has on families, the effect it's having on our healthcare system right now and our healthcare providers. They're difficult choices, but in this situation, we know we had to go along this line.
From the Winnipeg Free Press, Carol.
Hi, Dr. Roussin. At your press conference with the Premier on Tuesday, did you know then that the new Public Health Act order would say that people can still gather in groups of 5?
Yes. I mean, I work with the legal drafters, but ultimately it's me who writes those orders. So I knew that that's what we were doing with the group sizes, but we knew that right then we wanted the strong messaging that this is a stay home, this is a socialize only with members of your household. We knew that it would be challenging to write orders to mimic that with all of the necessary exemptions that would be required, and we didn't want to disproportionately affect certain groups that may feel that they had to forego their supports at risk of a fine. But the orders have never changed in that section. Certainly, we deliberate and work on different sections just to make sure it's applying properly. But there was no intent from public health to change that group size. There was a clear intent from public health to change our messaging to Manitobans to stay home.
Just because, I remember you saying that we need we don't want people to think that they can't have their home care come, or their child care, if it's grandparents babysitting or something, that they can't avail themselves of that. But why didn't you say on Tuesday that the Public Health Act orders aren't going to say that people should stick to their household? Like, didn't you think any media was going to be reading it? I'm just wondering, that might have that kind of heads up, hey, this isn't going to be in the order, but this is really what we mean, and we're not messing around, and this is why we're doing it. Do you think you might have been able to communicate that more clearly on Tuesday?
Well, I mean, I think the message is clear, right? And the message is unchanged. And I really, I'm really concerned that a lot of this is a distraction, right? And this type of distraction is harmful to what we're trying to do here. The message is clear, is that stay home, socialize only with members of your family. Certainly we have orders in place where we can fine people for certain things, but that's not the message. That's not the narrative. The narrative here is that we're at a critical point in Manitoba. Our hospitals are nearing capacity. We right now need to stay home, socialize only with family members, and not have any distractions to that. That's the message. That's the narrative.
Okay. Are you concerned that, there has been mixed messaging, like whether or not, whoever's fault it is, or, if it's the media jumping all over the health order when they shouldn't be, it's still getting out there and the messaging is being mixed. Do you think that, is there any other way around this? I mean, people can still gather in groups of 5, and I mean, you don't want them to, but they can. Legally they can, and that's the law. And shouldn't people know the law? Like, I'm confused and kind of frustrated.
Yeah, well, I mean, I think that the messaging is clear, and that's what's important, right? In the first wave, people could gather in hundreds in their house, all right? There was no limit to that. We had group sizes of 10 applying only to public places, and that was clear in the order, but our messaging was also clear, stay home. And that's our message now. So, I mean, I think certainly hear the people who are, thinking about this, but the message is clear. What we need to do is clear. To me, everything else is a distraction we don't need right now. Manitobans are suffering with COVID. Manitobans are suffering from the restrictions related to COVID. They need to hear just a unified message right now that we're at a critical point, and it's to stay home, socialize only with their household members, essential tasks only, fundamentals, and with that we'll be able to move forward.
From Global, Marnie.
Good afternoon, Dr. Roussin. You said it's obviously difficult to address every scenario in that order, but at the start of the press conference you did mention people who live alone. Some other provinces like BC have very specific guidelines in their order just to address people who live alone. Is that something that Manitoba would look at as well?
So we could, certainly look at guidelines, right? So guidelines are much easier to write, and that's what really the stay home and socialize only with your own household. But yeah, you're right. And just having that group sizes of 0 outside your household, could disproportionately affect people. And you mentioned one group there, people who live alone. So we just didn't want them to forego any supports they may have out of fear that they're going to be fined. And so we could get some guidelines on it, but ultimately it's socialize within your household for the most part for Manitobans. Some people who live alone, some people who get supports, essential supports, they don't need to worry about being fined if you have a neighbor helping you with with a task. But ultimately, we need to change what we're doing now, and that big change is staying home for the most part, socializing only with members of your household.
Thank you for that. And just with some various backlogs we're seeing in terms of contact tracing, were the number of Manitobans that have recovered from the virus as 3,620, is that accurate, or would that number be higher just due to some backlogs?
Yes. Well, yeah, it would be. So what we've done is that we have a proxy indicator of recovered cases. So as we know that individuals, almost everyone, 8 days after symptom onset are no longer infectious. We say 10 days just to give that grace period there, a safety buffer. And so what we do is we calculate a number of people 10 days even after their lab test result. So most people have had symptoms even before that. So 10 days after that, and then exclude, of course, people still in hospital. And so our current proxy for active cases is 3,163.
Thank you. And we're hearing, this might kind of apply to the loophole thing, but just some parents who might have their kids hang out after school or in play dates, but those kids are within the same cohort. What's your advice on situations like that?
So these are the type of things, again, that it's hard to give black and white advice to. If you, if it's necessary, if it's essential that you have child care, then that's one thing. If those kids are already in the same cohort at school, then that's something even on top of it already. So really hard to give black and white, but the real message there is essential. The play date, I would say, is not what we're looking at here. If you needed to have kids after school at someone's house because of work or so, if those are in the same cohort, then that's a lower risk activity. But things like arranging play dates right now, even if they are in the same cohort, I'm advising against. The message is stay home, socialize only with your household.
From the Brandon Sun, Emily.
Good afternoon, Dr. Roussin. So yesterday, I guess, no, it would have gone out on Tuesday. The government of Newfoundland and Labrador sent out an advisory that was targeting rotational workers returning to Newfoundland from a Seymour Pacific Development's work site in Brandon, Manitoba, that they had been notified by Public Health Agency of Canada that there was an outbreak of COVID-19 at that work site, and the Newfoundland government is advising rotational workers returning to their province self-isolate and get tested for COVID-19. So now I'm wondering why the government of Manitoba did anybody here to the fact that a business in Manitoba or a business in Brandon was thought to have a COVID-19 outbreak, and the fact that this has been subject to an alert in Newfoundland. Why weren't we informed here first?
So for one, we're still investigating a number of workplace outbreaks, and so we're investigating on that. So there might be more details to follow. Otherwise, in public health, our approach has been fairly consistent. That if there is a risk to the public, we're going to announce things. And so right now we'll wait on further details. But if there is any public health risk to the public, then we will be announcing that.
Okay. So we're hearing that. Give me a second here. Pull this up. So we're hearing that there's an inadequate supply of personal protective equipment at the Manitoba Health Center because some of their PPE, particularly N95 masks, have been recalled, as it has been phrased to us. Can you confirm this?
No, sorry, I don't have any details about PPE or its specifics at Manitoba. So we'll try to get something out there if we can get some information.
Okay, and could you clarify if elective elective surgeries, so not necessarily non-urgent, but what is the status with elective surgeries in the province? Have they been canceled until further notice, or are there still some elective procedures that are being allowed to go ahead if space allows?
Yeah, so I didn't bring with me any specifics on on a healthcare system such as this. Lynette will be out with me tomorrow and can answer such questions.
From CBC National, Cam.
Hi, Dr. Roussin. Listen, just want to follow up on the question earlier with the First Nations. I think we all know there's accelerating factors in those communities, like not being able to self-isolate or socially distance, perhaps as we can down here. Just given what we're seeing right now, I think it's the First Nations Health Secretariat is listing 34% of Manitoba ICU patients as First Nations. How concerned are you about accelerating cases on First Nations and what that can do to the broader provincial, capacity, ICU capacity in the broader provincial sense?
Yeah, well, it's very concerning to see that disproportionate effect on Indigenous people and in our First Nations. And so, we knew in the first wave, just like we see with other pandemics, even seasonal influenza and the pandemic H1N1 of 2009, there can be a disproportionate effect in number of cases as well as severity. And so it is concerning that we're seeing that. We work with our federal partners as well as leadership to do what we can. I know the pandemic response team, which is a multifaceted team that's been put together right from the beginning of this pandemic, is on the ground in these First Nations with rapid testing, and so it is concerning to see this, and it's also one additional reason why we've put on these such stringent restrictions is that we have to bring down that community transmission because we know it disproportionately affects certain groups.
I know this does kind of go into federal territory, but I mean, at the end of the day, it's our provincial health system that runs the hospitals that people wind up in. Is there a way to expand capacity in these communities or near these communities to try to alleviate the stress here in the south, or is there? I guess what I'm asking is are you working right now with the feds, with the rapid response team, to find a way to deal with these cases in community before they become part of the broader provincial system?
Yeah, and so it's, it is a challenge when you're dealing with remote, isolated communities to have, certainly hospital care close to home. Certainly there's work having care provided there. There are opportunities for alternate accommodation centers there. I don't have any specifics, for instance, on any remote hospitals being set up or anything of that nature. I know the Canadian Red Cross has done some work in that regard, but I don't have any specific details on that.
Okay, and just get back onto the public health order question. On Tuesday, why not just call it a recommendation, not a restriction, or strong advice?
Yeah, it's like we said, is we want the dialogue, right? We want the narrative to be stay at home, socialize only with members of your household. That's the message. So anything other than that is distracting from a very important message at a very critical time. So that's why we did it. That's why we're still messaging the exact same way as Tuesday. Because that's what the narrative has to be. Stay home, socialize only with members of your household.
Thank you.
From the Thompson Citizen, Ian.
Good afternoon, Dr. Roussin. First question that I'm going to ask is about 40% of cases in the north are among people 29 or younger so far. I mean, is there any significance in that, or is it just a reflection of demographics?
Well, it's a bit of reflection of demographics. It's also a reflection of what we've seen in this second wave. So certainly the second wave started off with a much younger demographic, and that's why early on in the second wave we saw relatively lower hospitalization rates. We're now seeing that trend change as we're seeing as it's getting into older age groups, as it's getting into personal care homes, as it's getting into First Nation communities. And so that young demographic is overrepresented in this second wave in total.
And is there any evidence or anything suggesting that some of the northern health districts with a lot of cases, like the Paw and Cross Lake, is there any indications of trends? Is it staying the same? Is it flattening a little? Anything like that?
Yeah, and so, overall the trend is in the wrong direction, and in certain communities we will see the flattening, and then other things happen. What we do see is that in especially in northern communities in the northern health region, that's where we've seen a lot of gatherings lead to transmission. So we've seen that in the funeral settings. And other type of gatherings, and certainly not unique there. We've seen that in pretty much every region, but it just highlights the importance of not gathering right now. So much of our numbers right now are very predictable. If you look at the transmission settings, large gatherings. Very predictable. We know that's how that virus spreads. So right now we're going to get back on track in all the regions in Manitoba. We're going to stay home. We're going to socialize only with our household members, and then we're going to start seeing these numbers start coming back to more manageable rates.
Okay, and just lastly, I mean, as a province as a whole, the case counts, the daily case counts day to day is sort of like more than 2 times what it was, say, 2 weeks ago. I mean, what could that spell for hospitalizations and deaths come the end of this month?
Yeah, well, that's precisely the trajectory that made us that really gave us no choice but to put these restrictions in. Right, this is even these case numbers right here, we can't sustain in a long term. So we need to see these numbers come down, and we certainly could not sustain another doubling of these numbers without any interventions. So this is precisely why we've had these restrictions now in place. Very restrictive, very difficult for many Manitobans, but we can all be assured that they're absolutely needed.
Thank you, Doctor. We have a few minutes left for just a few more questions. If anybody has further questions, please proceed.
I'm sorry. Dr. Roussin, I just want to know, there's supposed to be an anti-masker rally happening this weekend in Steinbach. Do you think that enforcement officers should be out there with ticket books fining people?
I think overall that people who are in violation of the public health orders should be there should be enforcement. We don't have time to educate anymore. We're at a critical stage right now, so I think anyone violating these public health orders, there should be enforcement.
Any further questions?
Hey, Dr. Roussin, that's Bartley here again. Just a little bit more on contact tracing. Do you know roughly how many more FTEs we need to get to where we could, within the 24-hour recommendation of that we had in place back in April?
So it's a combination of things. I don't have a specific number to that. we're increasing our capacity to be able to manage cases, as you mentioned there, much more than the amount that we're seeing now. Obviously, we want to be able to have reserve capacity. But while we're increasing the FTEs, the resources there, we're also streamlining the approach. And so when we, for most of this pandemic, we would have public health nurses doing almost the entire process of public health of contact management. So it'd be the case investigation, then finding out who the contacts are, then contacting all those contacts and notifying them what they need to do. That's really the time-consuming aspect. So now having Canadian Red Cross and StatsCan on board, we can have other people notify those contacts, leaving the public health nurses more time to do the actual case investigation to compile the contacts. So we've approached it from a couple different directions. So with that, our capacity is increasing all the time.
And a completely unrelated question. In both cases this week, we've been made aware of healthcare workers who've died of COVID. The province has not actively been disclosing the deaths of healthcare workers. In your opinion, is that something the province should be doing actively?
Well, I mean, first and foremost, we send our condolences to those family and loved ones, right? These are our healthcare workers that we rely on during this pandemic. As far as the disclosure goes, I think that there's been privacy issues raised with this. So, I think first and foremost is we need to reverse the trend of this virus. We can't lose any more healthcare workers, to this. We don't want to lose any more Manitobans. But yeah, I think there's been some privacy issues with that, Bart, and so I don't have a complete answer to that.
Well, just curious for your opinion on that. Thank you for it. Thank you very much today.
Dr. Roussin, Marnie from Global here. Can you provide an update on the deaths and current cases at both Maples and Parkview Place?
Yeah, sorry, I didn't bring the update today. I'll have that tomorrow. We just sort of today came out to to address the orders and things. So I don't have that. I'm sorry.
Thank you, everyone. This concludes today's media briefing.